Hi, my name is Stephanie Fabian, Director of the Mayo Clinic Center for Women's Health. I am privileged to be the senior author on an upcoming manuscript to be published in the Mayo Clinic Proceedings entitled The ISSWSH Process of Care for the Identification of Sexual Concerns and Problems in Women. Distressing sexual problems are common and affect 12% of women across the lifespan. These problems relate to sexual desire, arousal, and orgasm. Low desire is the most common of these, but other problems such as sexual pain and difficulty with arousal or orgasm are also seen in clinical practice. Unfortunately, female sexual dysfunctions often go undetected and unaddressed in primary care settings and are frequently undertreated even when they are recognized. With this process of care, my co-authors and I hope to provide clinicians with recommendations for the identification of sexual problems in women. In this manuscript, we review core and advanced competencies in female sexual dysfunction for clinicians who are not sexual medicine specialists and serve as caregivers of women. We begin with the expectation that all women should be screened for sexual concerns and go on to describe a 4-step model consisting of 1, eliciting the story, 2, naming and reframing attention to the problem, 3, empathic witnessing of the patient's distress and the problem's impact, and 4, referral and/or assessment and treatment of the problem. This model accommodates all levels of engagement and delineates a process for referral when the patient's needs exceed the clinician's expertise or level of engagement. At a core level, even delineation of a problem may be therapeutic and help a woman to start solving the problem. Providing education may entail explaining the sexual side effects of a medication, the changes in sexual function related to menopause and/or aging. Clinicians at a core level may provide recommendations for management of vaginal dryness. Assessing the patient's ability to talk to her partner about sexual function and experiences, and providing coaching about better communication are important and effective interventions. However, many sexual health concerns have a biopsychosocial etiology, meaning they may relate to one or a combination of biological, psychological, interpersonal, or sociocultural factors and may be best managed by a multidisciplinary team. Advanced level skills include more detailed history taking and review of sexual functioning, as well as identification of specific contributing biopsychosocial factors. Management at the advanced level might include targeted pharmacological, device, or behavioral interventions to address sexual dysfunctions. The goal of this process of care is to provide guidance to clinicians regarding screening, education, management, and referral for women with sexual concerns or problems. Because this is such a common problem for women, having providers who possess the skills and knowledge required to screen for sexual problems will serve an unmet need and will ultimately improve the care of women. High-quality, randomized, controlled clinical trials on management strategies for female sexual dysfunctions is sorely needed. Going forward, the International Society for the Study of Women's Sexual Health will continue to drive consensus on the identification and management of female sexual health concerns and problems, and to be a resource for evidence-based care for providers and for patients. Thank you for your attention. I hope you find our consensus recommendations useful in the care of your female patients.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.